Hello, everyone, and welcome. This is Denise Solzbach. I am the Director of the National Center at the Institute for Innovation and Implementation at the University of Maryland School of Social Work and Deputy Director of the TA Network. I want to welcome all of you to today's discussion on Managing Now for a Better Tomorrow, part of a series. We are going to be tweeting throughout this discussion. If you'd like to join us, please use the hashtags BetterTomorrow and TA Network Talks, and please do tag us at Institute UMSSW. We truly hope this conversation finds you well and safe today. We do recognize that this is a challenging time for us all in children's services across the country, most especially for the families and the youth that we serve. We've created these conversations to create peer-to-peer opportunities for you to talk with the panelists and presenters as well as one another. We do encourage you to use the chat box. We see that many of you are doing that now to share your thoughts and resources as well as questions for the presenters throughout the discussion. Everyone who registered for today's conversation will receive the recording as well as chat box discussion and resources. When you do use the chat box, please select all participants so that we can all see your messages. This is very much a conversation. We will not have a PowerPoint during the discussion. You will see the presenters joining us from their homes and being who we are during the situation. We do truly appreciate you joining us. We also look forward to creating forward-looking solutions that meet the challenges of today while building a brighter tomorrow. We particularly value your partnership today as we are still experiencing some East Coast high winds. So if you lose us, please log back in. And if we lose you, please stay with us. We have a troubleshooting team ready to assist with backup plans. As I mentioned, this is a conversation series. We had two crisis communication discussions held on March 21st and 31st. We also had an in-home behavioral health discussion held on March 26th. Yesterday, we had a very robust discussion about supporting families. That discussion was so full and over capacity that we've scheduled another one for Monday, April 13th at 3:30 p.m. Eastern Time. We also have a discussion on infant and early childhood mental health on April 14th at 3:30 p.m. Eastern Time, and mobile response and stabilization on April 16th at 3:30 p.m. We're also working on scheduling supporting tribal communities, housing instability and homelessness, and rural healthcare, as well as some other topics. We encourage you to continue to join our discussions. And I'm trying to get to my next page. We encourage you to join us in our upcoming discussions. Please check out our webpage at theinstitute.umaryland.edu/COVID-19. There you will see other discussions as well as other resources that we have to share with you, as well as the recordings from prior conversations. As I mentioned today, this is a conversation on residential care during COVID-19. We're very fortunate to have a great group of presenters and panelists to enhance our discussions. We have Liz Manley. She is with us at the Institute for Innovation and Implementation at the University of Maryland School of Social Work, where she's a clinical instructor. She also is a lead consultant with the TA Network, so she does work directly with several of the communities and states that you work in as well. And she is the director or leads our clinical and workforce efforts. We also have Christopher Balanci. Dr. Balanci is with the Judge Baker Children's Center at Harvard Medical School. Dr. Balanci acts as the medical director for the TA Network. Also joining us today is Mark Nickel. He is the director of Building Bridges Initiative, as well as John Shimana. He's with the Child Welfare League of America. In addition to our presenters, you will see in the chat box and have access to them as panelists, Ruby Goyle-Karkik. She's with the Council of Accreditation and formerly with the state of New Jersey. Yvonne Rockwood with the Joint Commission on Accreditation. Hi, Yvonne, I see you waving to us. Julie Ellis-Lang, she's with CARF International. Harry Sisson, the Association of Children's Residential Centers. And Alan Vietz, who is also a TA Network and one of our partners. So we welcome all of you. We can't emphasize enough that this is a conversation. Together, we are stronger in creating those forward-looking solutions. So please continue to participate throughout the chat box and help us together build a brighter tomorrow. And with that, I'm going to turn it over to Liz, who is going to get us rolling.
Yes, thank you, Denise. That was great. And I just wanted to take a minute and thank all of our panelists and our partners today in having what I think is a really important conversation about how COVID-19 impacts on providing good residential care for children. I hope this is not our last conversation, but really the beginning of a series of conversations around how we can work together. If you have questions, please put them in the chat today, and we're happy to answer them. And I'm going to hand over to Dr. Christopher Balanci. Thanks, Chris.
Hi, everyone, and welcome to this conversation. It's a pleasure to be here with all of you virtually, which is becoming our new normal. And a lot of what we're going to be talking about today really is adapting to this new normal. If crises have a beginning, a middle, and an end, I'd say we're kind of finishing the beginning and moving to the middle as we all learn to adapt to providing the services that all of you are providing, really a critical frontline service to some of the neediest children and families in our society, and trying to figure out how to do that in a safe way, both for your staff and for the children and families you serve. And so there are really, in my opinion, very few scripts to work from for this kind of a crisis. Liz and I were both reflecting back on 9/11 when we were both working in residential settings, and as overwhelming and all-consuming and frightening and despairing that event was, you know, it was kind of self-contained, and what's different about this experience is that its impact is universal. The impact is on our staff who are worried about becoming ill, who have children at home that they're trying to care for, and then balance that with showing up for their work shifts, and worried about bringing this virus into the facility, as well as taking that virus home to their families. It's got impact on children, many of whom are now have their contacts with their families or their social workers or their loved ones physically limited as we try to contain the virus's spread. And the universal stress that really the whole world is under. No one has been spared from this virus. And as most folks know, without a vaccine or without a treatment for the virus, we don't have control of the virus. We only have control of our response to the virus. And really that comes down to social distancing, a word that we hear, or words that we hear all too frequently. And so I think the conversation today in many ways is about how have you adapted your practice to this new reality. And while we have some great experts on the panel and as presenters, really all of you are at the front line of doing this. And so what we're looking to do is facilitate a conversation and the sharing of resources. So if you have developed your own guidance for your staff, if you've adapted your practices, if your associations have come up with some great ideas, that's really what this session is about. And please type those in. You can use a hyperlink if it's a web-based resource into the chat box. Feel free to respond to questions that come up in the chat box. We have over 500 people registered for this conversation. We already have 460 signed in. So as you start adding resources and posing questions and responding to each other in the chat box, that's exactly the conversation we want. But you'll see the chat box will start scrolling pretty fast. Don't worry, we will collect the resources as well as the discussion in a transcription that we will share with all of you as participants in this conversation. So I thought I'd start off just a little bit about kind of a coronavirus or COVID-19 101 for those of you who aren't as up to speed. I would imagine at this point, as we're switching from the beginning to the middle, many of you are already very familiar with what's needed in a congregate care setting. I'm going to share a resource in the chat box developed by Massachusetts that I thought was really quite well done. talking about ways of ensuring or limiting the potential exposure to your populations that you're serving in the residential space. So obviously, I would imagine at this point, most or many or all of you are limiting visitor contact into your facilities. The challenge of this virus is that you can be spreading it before you know you have it. And even if you're screening your staff by checking their temperature before they come on shift, the evidence seems to suggest that at least 2 days and as much as 14 days before you're actually showing symptoms, you could be spreading this virus. And so even though you're not symptomatic, it doesn't mean that you're not bringing that virus into the facilities. And so that leads to a very, very challenging conversation or decision about whether or not you allow people from outside of the facility to come into the facility. And we're talking about families, we're talking about the loved ones of these children and the challenges that that ensues, and whether or not you're able to make up for that physical contact, in-person contact through virtual means will be one of the things I think we're all really interested in hearing what kind of adaptive strategies that you've developed. I'd also be interested to hear whether or not any of your sites have actually experienced a COVID infection, either with your staff or with your children in your residential facility, and how you're responding to that. I know many facilities are trying to get as many young people who don't absolutely need to be in the facility out of the facility, since congregate care settings are such high risk for the spread of this virus. And what you're able to do in that regard. Obviously, that also has impact on your bottom line, and how do you maintain the business side of this while trying to do best by your clients, the young people you're serving, the families, and the contractors. For those of you that had some excess space, I've heard of innovative solutions where young people who have become infected are being put in that additional space with dedicated staff to work with them, or in some cases using the excess capacity to actually provide overnight accommodation for your staff who might be worried about bringing those infections back. I would imagine, though, that has a limited shelf life in terms of this virus, which we're really talking about potentially lasting 12 to 18 months before we have a vaccine or some solutions to or treatments for this virus. So that's kind of the long picture that we'd be thinking about. Hopefully, once we get to the other side of the curve, which we're all hearing so much about, we'll be able to identify who may have been exposed through antibody testing. It would be safe to be back in the workforce, meeting the needs of these children and families, as well as some of the children themselves who may have gotten sick, but we may not know whether or not it was COVID, because of course it's still the influenza season and other colds and other aspects that could be interpreted as a COVID case, but we don't know until we actually are able to test. So those are just kind of my opening comments. I'll stop there and turn it over to Mark Nichols at BBI.
Thank you so much, Chris. Really appreciate that. And so I'll just sort of launch in with a couple of different components that we wanted to share. One is around staff support and staff retention during this time. Things that we've been learning from our partner organizations and elsewhere across the country, and then also just how agencies are maintaining family engagement during a time of quarantine. So those are the two sort of critical components that I think are really facing residential providers at this point. And people are bringing a tremendous amount of flexibility and creativity to these endeavors. So I'll start with the staff support and staff retention strategies, and there are basically 4 of those sort of categories that we're learning that from y'all, from the residential providers who are in the field and really trying to figure out how to navigate this extraordinary time. So the first is reaching out to and partnering with oversight agencies. So your your funder agencies, when they're giving directives and they're giving requirements and recommendations regarding how to manage the crisis, that's one thing. But we also want to look at what their recommendations and requirements are around training new staff, hiring new staff, bringing in and sharing staff resources, and I'll get to that in a minute. But this idea of partnering with, I'm the type of person that always asks forgiveness rather than permission, which is a really bad quality when it comes to managing what you have to do in terms of compliance and in terms of all of the different agencies and organizations and oversight agencies that you're working with and beholden to. So the idea is to be proactive around reaching out to those agencies, whether it's child welfare leadership, juvenile justice leadership, behavioral health, or an accreditation body that is also part of making sure that your quality assurance standards are up to par. Bringing questions and concerns to them in a proactive way is something that a lot of agencies have done that seems to be really helpful. So sort of sending a signal that we're looking for guidance around how we might continue to staff our programs during this time. And so within that, thinking about compensation and financial support and resource support. We've seen a lot of organizations across the country that are doing crisis pay or hazard pay for their staff who are coming in during this time. But there's a lot of folks, staff who may not be symptomatic, and as Chris was indicating, this is an asymptomatic sort of pandemic, so you may not even know if you're carrying the COVID-19. But even if you're not, having your kids sent home from school, there's a lot of school closures, which are really impacting organizations' ability to be able to just safely staff their milieus. And so thinking about different strategies around that, we definitely want to learn from folks who've been incentivizing folks to come in, acknowledging that this is an extraordinary time, in the same way that our healthcare, in general, our healthcare facilities are really looking at all of that in terms of how to just keep folks supported while they're coming in to manage these extraordinary circumstances. So some of the other things that we've learned from provider organizations, in addition to the crisis and hazard pay, include food gift cards. And this is something that a lot of providers do for families, where they'll have a gift card to a grocery store. And just that sort of basic need, meeting those basic needs. We're learning that a lot of staff who are working at our facilities also are needing that kind of support at this point. So sort of extending those types of basic need resources to your staff is a really creative intervention that a lot of organizations have been doing. And in addition, rent support. And we're learning a lot about this in the news, but the idea of some organizations actually providing rent support to families, which is part of the core, like aftercare, and we learn about this in wraparound and other sort of interventions that are developed and implemented as a part of discharging a youth back home. But we also want to think about that with regard to our staff. And are there folks who are coming up short on rent and need that kind of help? There are definitely agencies that have been sort of, moving money into that kind of support. So rent, just that idea of basic needs, the housing, food, and all of those things that people are really stressed about right now that you may or may not be able to have resources to provide. And then that goes back into the conversation that you might have with your oversight agencies around a different rate or the hazard pay. Just again, bringing resources to bear for the workforce so that they can show up and continue to maintain healthy cultures of care for the youth and their families while they're going through this process. And then there are a couple of other strategies that we've seen, that BBI's seen, that have been really effective. One is around new staff training protocols. So, and if you're a provider in the audience, when the economy is good, it's actually really hard to retain staff. And when the economy is bad, our staff retention tends to increase. And, I think that's an interesting conversation there. But I think that in general, what we want to look at is are there folks who are unemployed now that are looking for work that would be really highly qualified for types of roles that you need to have filled? And so thinking with your oversight agencies and with your accreditation bodies around background checks, around vetting processes, and around training protocols for folks who are entering the workforce that would be really wonderful caregivers. And I think that's just coming from the provider world now into the BBI world. We would always, worry about maintaining, safe staffing ratios, but you don't want to just, fill it with whoever is showing up. You really do want to have a vetting process and maintain that level of quality of care. But there are a lot of folks who are entering the workforce that this might be an interesting opportunity to sort of bring them into your programs and into your models that would be really helpful around maintaining your staffing levels. So with that, thinking about virtual learning, there's been a lot of agencies and jurisdictions that are implementing virtual learning for new staff as they're trying to hire folks into programs to manage the safe staffing ratios, but then also developing protocols around crisis intervention skills. And again, this kind of goes back to, you're not going to want to necessarily hire anybody who's needing work, but you do want to open your doors to potential employees that actually have really great skills or are really open to learning these types of interventions. So having that kind of robust framework of training and vetting is something that a lot of organizations that are trying to get out in front of their staffing crisis and staffing shortages are doing, in addition to also shadowing seasoned staff. So setting up a protocol where you have a virtual learning as sort of tier one, and then in person around crisis intervention skills and crisis response, and then up to shadowing, up to and including shadowing seasoned staff for these types of skills that we're hoping that people will bring to bear. And then the last strategy, which is kind of an interesting innovation, and I would love to hear people's thoughts on this in the chat box, is around cross-agency staff exchanges. So we're seeing some of this happen in pockets, but it hasn't really taken hold. But if you have other agencies that historically you've maybe even competed with around RFPs or that sort of thing, reaching out to those leaders and those other organizations to talk about the fact that you have a workforce with a set of skills that can be brought to bear, and how might we sort of exchange those resources in an emergency situation where shifts can be covered, and we have people who aren't new to this work but are actually very seasoned that can be brought into other organizations that you're partnering with. So that cross-agency and staffing protocol is also something that you would want to run by your oversight agencies and your licensing bodies and your credentialing bodies to make sure that all of that makes sense. But that's one way that people are managing staffing shortages, particularly in like New York and now Louisiana and California, where we're seeing a lot of staffing shortages. So really quickly, I'll just shift gears into the family engagement strategies, because that's the other component that I think a lot of our residential providers are really struggling with. Is so not just the maintaining safe and effective staffing levels, but also how do you maintain family engagement when you're getting directives from state and local governments around quarantine and isolation. So some of the strategies that we've seen for maintaining family engagement, and I really also just wanted to highlight and appreciate UMB and the calls that we've been doing. Like last week, the idea of the language of moving from social distancing to physical distancing, I thought was such a critical suggestion. And even though that's just a word change, it signals a philosophy and a principle around we need to help families maintain engagement even if they can't be together physically. And that's something that BBI has been doing and working with agencies, for the last 15 years around how you do that. But certainly it's never more important than now, during this time. So some of the strategies that we've been learning from our partners include calls, FaceTime, Skype, and making those types of connections optional at any time. So really doing away with this idea of levels and point systems and that sort of thing when it comes to engaging your family. What we're seeing is a lot of youth and children in care are very anxious during this time, and understandably so, and their families are as well. And one great strategy to help mitigate some of that is allowing sort of a free flow of contact between families and youth. So that's a really critical strategy that people have been employing in terms of FaceTime and Skype calls. Now, what we're seeing too is that there are a lot of families who may not have the technology to be able to support, like either they don't have a laptop or they don't have a phone that allows a FaceTime or Skype type of call. And we're seeing a lot of organizations that are spending some money and delivering those types of devices that allow for that kind of telehealth and teleconnection in a more fluid way with families during this time. And so that would be also something that you might want to talk to your oversight agencies and your funders around. How can we continue to implement some of these strategies when the parents or the extended family of the youth that's here don't have the ability to maintain this level of contact, and how can we increase that? So that's something that a lot of organizations are working with their jurisdictions. As somebody who actually has written letters to people and put them in envelopes and stamps and the whole 9 yards, that's also it's an antiquated way of communicating, but it's a great way for youth and their families to communicate with each other. It's almost like a form of journaling, where you get to write a letter and do that almost like a pen pal exchange. So creating those opportunities for youth while they're in your program to be able to exchange thoughts and feelings through snail mail, as they call it. But the old school way of doing it is also a really helpful strategy in terms of anxiety reduction, and then also maintaining that engagement. And then having your staff communicate with families via phone around the client's well-being. So around the youth's, how are they doing, and sort of setting their mind at ease. So having daily calls with from your staff to the family members not just around what's going wrong, but actually what's going well, and how they're doing is something that a lot of agencies have been setting up. And that's something that is just a great practice to implement in general, sort of even outside of this crisis. So creating opportunities to communicate your staff, to communicate with families around client well-being at regular and ongoing and predictable intervals is a really important strategy. Last two here before I turn it over to John is resources for families. So Chris has put a lot of stuff on the website around talking with children during the COVID-19 pandemic, around being trauma informed and just how you communicate this with families that's developmentally appropriate and trauma informed. There's a lot of resources to be found online around that, and a lot of agencies are really doing this. With everybody from their admin staff to their frontline staff to their clinical staff, just having them look at these resources, actually read them, because there's some wisdom in that, in order to be able to communicate effectively with families during this time, specifically around what's happening, and in an effort to sort of reduce the anxiety and worry. And then the last thing, of course, which I mentioned earlier around providing staff resources, is also providing resources for families. Massachusetts is doing a critical work around this effort to where their residential providers are actually bringing food baskets and other basic needs resources to families in the communities where they're living while their youth are home, as a way of both reaching out and engaging families, but then also helping them through this this extraordinary time while folks are really struggling. So providing resources for those families of the youth while they're in your program is something that a lot of agencies across the country are really thinking through and how to do really well. So I know I threw a lot out there, but I'll pass it off to John, who can take it from here.
Heard already is kind of reflected in what we have heard overall from our members. I mean, I think back to a few weeks back, we were actually supposed to have our national conference in Washington at the end of March, and we got to a stage there about mid-March, or a little earlier than mid-March, maybe around about a month ago, where we were thinking about were we going to have to maybe delay the conference because we were losing some membership, but it was a little bit questionable whether we should do that or not. And then I think after going through some procedural internal process, we did announce that we had postponed the conference on, I think it was about March 12th. It still seemed like a close call, but boy, since then, things have just cascaded at a rapid rate. I think we went from thinking about how can we maybe do some sort of virtual type of conference to what can we do to help our membership in the coming hours and days, really. So that's what we've really focused on. And I think some of the things you've heard about has been almost cross-agency in terms of some of the concerns. And I think the greater concern too is that as this continues, these challenges, I think, become even greater, even though there may be some lessons learned and some practices developed. But resources. So, I mean, I think one of the common issues and challenges, certainly the agencies themselves in terms of resources. A lot of the agencies, of course, are nonprofits, and they've subsidized their budgets frequently with fundraising. Those kinds of resources are likely have dried up or aren't available. And so what is the strategy going forward? That's actually why we're doing some of the work we've been doing in Capitol Hill, is hopefully to fortify those budgets in as many ways as possible to address the agency needs so they can go on to do these practices. And the other obvious one, I think, that is pretty common, regardless of the placement of the facility, is the workforce, and some of the very same issues you have here in terms of how do you protect the workforce, how do you support them. There are there are income and salary issues, and now you're asking them to take on some actually really extraordinary responsibility. So those continue to be, I think, issues and factors that will probably only grow over time as as this goes on, even if we get into some sort of transition where we think we are over the hump, but we still aren't really ready to go back to whatever normal might be. So that's, those are some of the common things we're hearing about agencies. So we've done a few things, including participating in events like this and other webinars. We have an open mic on every Monday afternoon. We just started that so people can just talk to each other in terms of getting strategies and asking questions. And we're probably going to double down on that in certain ways and focusing on different groups because there are challenges. And I think a lot of our membership and a lot of folks want to talk to others and see what their experiences are. And because we are learning this on the fly, as I think maybe Chris said earlier. And so we're doing those kinds of things with our membership. We're also, we sent a document to Capitol Hill a few days ago, or I guess earlier this week, that basically laid out the description. We didn't have a set of recommendations, but what's going on. So in terms of the workforce, in terms of the agencies, in terms of the families being served, and the challenges for residential as well as kind of other services, from prevention all the way to placement to youth issues, which are a concern. So, we're seeing some of the commonalities in terms of some of the state practices, in terms of recommendations of what residential providers need to think about, especially as this rolls out across the country. But issues around, obviously health practices to prevent the spread of the virus within the facility. And also obviously has to be staff-wide. So even the support staff, you need to be aware of. Discussion about a strategy around cross-training. If you do lose staff, how do you compensate for that? There are issues around the loss of staff, as you've heard some discussion about that and how you address that. Also the things around in cross-training, if that is possible. There is, I think, in terms of workforce, in terms of facilities, also in any circumstances, is the use of PPEs, personal protection equipment. Obviously, as we all can see from the news, there's a great demand and shortage of this kind of equipment. So how do you deal with those kinds of issues or those kinds of shortages? How do you meet the proper kind of procedure within your facility, especially as you're being challenged with this? Also, procedures around screening your clients, and then what are the practices there? And do you have the kinds of supplies, even things as basic as thermometers and the like, to be able to track the clients? And if there's relocation is required because of some sort of exposure, what's the strategy there, and are there options? We know that I mentioned youth, which obviously are involved in some of these placements, but also about independent situations. And I think a lot of localities and jurisdictions are just struggling with how, if you need to find an alternate placement, where is that placement? Especially if you get in a really, the hot spots of a city like New York, or I suspect in New Orleans and Detroit, they're having some of the same kinds of challenges. So, we're, trying to keep the discussion going between our membership and so they can learn from each other, and so they can deal with some of these issues. I think a common thing that we just heard about in terms of the virtual visits, so we're seeing that in many settings. Doesn't always work. Of course, you've heard a lot about, outside of facilities is the issue of child protective services, and it's the one category that seems to be less open to virtual visits. But also the issues in terms of when virtual visits can be successful. I think you also heard mention of the fact that the agencies may have the ability to at least ramp up in terms of some of that technology, at least for now. May change as we go down the road here in terms of budgets. But the challenge is, of course, with the families and the clients, things as basic as cell phone minutes, or whether even the family has an internet connection. They may have it, but is it strong enough? Is it capable enough? And how do you kind of coordinate those services? And I think these kinds of issues all kind of get more complex, more challenging as time goes on. I think we had some conversation with one of our Arizona members about they felt they had enough of a budget for the next 30 days. But, you know, what happens after that? Of course, there are various sources of federal funding that, you know, as you've heard, is getting out there, but very slow. And so there are interim questions in terms of how you survive over that interim until this money starts to flow. And then how much? I mean, we're obviously flooding, you know, dollars into any kind of whether it's trying to get these loans to small businesses, which include nonprofits. But what do you do in the interim? But there's also the other things in terms of health reimbursements, Medicaid, Medicaid funding. There has been a temporary increase in every state's Medicaid match by about 6.2%. There's a move that I think the governors are in support of, and some advocacy groups, including us, to increase that Medicaid match even more, so there are more dollars flowing into the state budgets and to programs, because I think there's a lot of anticipation that's going to be increased demand for Medicaid. So looking at those kinds of things, I think also the staff issues we've heard, and people are different opinions, whether you call it hazard pay or other kinds of pay, but how do you supplement and fortify the workforce? But it's going to be, I think, again, even more critical as people are being asked to make some commitments, you know, and they have families too. And so if there's exposure, what happens then? So how do you support that? And how do you support the, you know, families that are you're trying to maybe reunify? Again, I think the income issues there are challenging. Again, there are different kinds of resources out there with the unemployment and the checks coming through, but that's not flowing real easily. Hopefully it will eventually, but these are ongoing challenges that affect both, I think, the workforce, but also the families. So how do you coordinate all of those kinds of things? And so, you know, what we're doing is trying to continue to connect with our members, you know, and having these kinds of discussions and hearing what people are saying so that we can educate policymakers, but also educate each other in terms of as this moves along. You know, and I think there's also concern about how long this will last. There's, you know, there's some initial discussion here about, you know, if we've peaked, and then what does that exactly mean and how do you transition? Because there is the issue of not just the pandemic, but the economic consequences of what the pandemic is going to cause, is already causing, but what will happen in the months after. You know, is there some sort of delayed need or response as we try and shift back to, you know, getting everybody back to work? But also are there issues, are there challenges that we haven't been able to address and serve families, as well as I think this child welfare is not unlike childcare in some respects, in that you have an infrastructure that isn't hugely funded and that is as challenged in terms of their budgets. And so we've got to make sure that that continues to exist so that those agencies and those providers will still be there when we do start to recover, try and transition out. I think those are, I mean, some of the main points I think we have found in terms of, you know, this issue. As I say, a lot of this is common. There are obviously things unique to residential placements, but also some of there is also things that are common and not easily addressed, such as the agency needs and the workforce needs and interacting with families. And I think that's about what I've come to observe so far.
Thank you, John. Appreciate it, and thanks to all our panelists so far. We have quite a few questions in the chat, but before we get there, I just wanted to make two comments. Number one, I think I've heard from one of the residential partners that I do a lot of work with that one of the priority goals for them was to communicate with all levels of their staff, with their board, with the community, with youth and with families. And I just wanted to highlight that it is really important to have a good communication strategy right now in which you're communicating with all of your partners on a regular basis. So that's one thing I wanted to say. Two, there was two really, I think, great points in the chat that I wanted to bring attention to. One, this is a great time to use the role of peer support and your peers to reach out to families and be able to keep in contact and keep supporting those families. And two, this is a really good time to enhance the use of things that help children feel better and calmer. And so just wanted to highlight those two things that were in the chat, things like weighted blankets and things that really help children feel calmer in the work. And then I wanted to throw a question out to Christopher. There's quite a few questions in the chat around the use of masks and whether or not that's a good thing or whether that's advisable. And I was wondering if you might want to take that one on for us.
Sure, and it depends a little bit about what kind of mask we're talking about, whether we're talking about one of the N95 masks, which are medical grade and if properly fitted, which actually most people are not properly fitting the masks, would have much greater protection from viral spread. The cloth masks, which we're all being encouraged to wear now when we're out in public, don't truthfully protect one from viral spread. It is a reminder for us not to be touching our face, and so in some ways that may decrease the contagion. But if you sneeze through one of those, you're still going to be spreading the virus. And I think on balance, we also have to be thinking about what it's like for the young people. We had a little exchange in the chat box about that, and it sounds like some of the young people are actually adapting pretty well and almost appreciating that staff are being thoughtful about not wanting to spread the disease, and some of the young people in these residences are actually asking for masks themselves. So I think part of it is also the messaging we use around the masks, and certainly being as thoughtful as we can about balancing the potential for our staff to spread the virus to the children or the children to spread the virus to the staff, and thinking through the implications of that, and just making sure that we're describing why we're doing that as we would any other kind of novel intervention in the lives of children. I'm assuming most centers are limiting the amount of news exposure while still trying to communicate and convey what's going on in the world around them. And so I think it'd be interesting to hear about what folks are doing. I did share two, believe it or not, there's already two new children's books, one put out by the World Health Organization about COVID-19. So I think those kinds of resources are really going to be helpful in trying to talk about this pandemic with children, trying to give them honest information while also not heightening undue fears. And I think that's a balancing act that we're all engaging in right now. And the book from the World Health Organization actually does go into wearing masks and social distancing, and even is written from a cognitive behavioral approach and embedding some cognitive behavioral strategies around self-regulation and calming strategies that I think are really quite appropriate. And it's written for about a 6 to 11-year-old developmental level.
That's great. Thank you, Christopher. I have another question for you. You did answer this already in the chat, but I was wondering if you might want to reiterate it again. For youth who go missing and are not in the presence of staff and they don't know where they've been, what is the best way to engage those youth when they return to the residential?
Yeah, I'd want to know as best as possible, as much as they're willing to tell us, where they've been and who they've interacted with, just as we would about whether or not they've engaged in any kind of illicit substance use or concerning sexual behavior. In this pandemic, we want to know who have you been around and were any of them seeming sick to you? Did they say that they had tested positive, or did they appear to have a fever? You may not get accurate or reliable data, but at least gives you some measure of understanding, because what we're really trying to do is minimize risk. We can't control the risk associated with this pandemic, and so we do our best to try to minimize that risk. So I think that information can help you to then know, well, how do I need to respond? If you're fortunate enough to have excess capacity, as some programs have indicated they're using as almost a quarantine dorm or a portion of their facility, then you might want to have that student self-isolate for the 2-week period that we talk about after potential exposure. That's challenging, but if you can do that, that's great. If you're in a program that has single bed capacity, I think that also, again, makes it a little easier. And in truth, one of the natural consequences of leaving a facility and then coming back into it is that you're probably going to need to be self-isolated for some period of time. And I would actually let the residents know that that's going to be the expectation. So they know in advance, if you take this action, which is within your control, this is how we're going to have to manage that to ensure that you're not making your peers sick or our staff sick.
That's very helpful. Thank you. I was wondering, since we're talking about re-entering, there's some folks in the chat who are talking about how do you bring youth into, as a part of an admission process now, bringing a youth into a residential intervention. Would you do that? And if you did, what would it look like?
Well, I do think that, as some people in the chat have talked about, juvenile justice facilities are really trying to divert kids from having to be in congregate care settings. I think child welfare systems are really at the front line of this pandemic. Many offices are closed. They're trying to figure out how to do their monthly visits remotely. We manage the Child at Risk hotline for the state of Massachusetts after hours at Judge Baker, and we've gone fully remote for all of our staff taking those reports. And so I think everybody's trying to figure out how to prevent the need for children to be in these congregate care settings. If you've got if you're a facility where residential is only one component of your service array, might you be able to move these children within your service array to the non-congregate care settings? Mm-hmm. And I think decisions are being made with a different metric around trying to figure out relative risk, because by putting a child in a congregate care setting right now, you're increasing the relative risk of getting this disease. And so how are we going to manage those decisions around what's the greater evil and what's the greater good, and what does safety look like in the midst of a pandemic?
So it seems to me that the answer to that is it's a very individualized decision around what to do, and whether or not it makes sense for this particular youth in this particular program at this particular time. But that part of it, the consideration process, is really about making sure that we've ruled out all of the ways that we might be able to engage that youth in a non-residential intervention up front, using some of the current technologies that exist as well, correct?
Absolutely, and this may be the new normal. You know, as we adapt our practice, I think people need to be thinking about the long term. You know, what's the exit strategy from this pandemic? Because there's no easy way out. As I mentioned in my introductory comments, without a treatment or without a vaccine, we're going to continue to have hotspots that pop up once we're able to stop socially distancing and bring the economy back and have people going back to work. And so the risks are going to be there for the long term. And I think that's going to enforce a different kind of calculus that we all need to be thinking about in terms of how we're serving the needs of children with behavioral health challenges that warrant admission into a residential setting.
Yes. So, in fact, there's a comment in the chat that says the issue is really whether the likelihood of them getting sick in a dangerous way is greater risk than the youth with significant psychiatric needs being denied or delayed admission. And I think that those are the really complicated decisions that have to be made in this day and age right now. And there's no easy answer for anyone making these decisions right now.
I think that's exactly right.
Right. We have just while we have you talking, there's a lot of questions around that Massachusetts 10% for the residentials. Was wondering if you might want to just address that for a second for us.
Yeah, and I don't know all of the details of it, and maybe there may be others from Massachusetts who have more of that detailed information. I don't think it was just for residential providers. I believe it was actually for community-based providers as well. But I think the leadership in Massachusetts has been pretty progressive and have clearly indicated that they want to ensure that the frontline essential service array is still here after the pandemic. And recognizing what a financial hit so many providers, mostly nonprofit providers who are on the front lines of responding. Massachusetts has also committed $800 million to the healthcare and hospital system in Massachusetts. Now, some of those are dollars that they're drawing down from the $2.2 trillion CARES Act that was passed, and making the decision about ways that they're going to invest those dollars into their provider community. And I did chat about, this is a time for advocacy. This is a time to ensure that your parents are speaking up about the essential need for residential to be available during and after the pandemic, because so many providers are going to go out of business if we're not ensuring that we're taking care of them financially, as well as working collaboratively with them to meet the needs of the population.
Oh, I think you're absolutely right on that. And I think that's some of the work that I think Mark was talking about, of trying to really work and negotiate with your oversight agencies around some of the challenges and struggles right now. Correct, Mark? Is that what we were talking about?
That is, and being really proactive about those communications. So doing a lot of outreach right now with whatever your struggles are. What we're finding at BBI is that there's a very receptive audience in terms of oversight agency really wanting to know how they can help, and it's an amazing sort of stance that they're bringing to bear on making sure that these resources are maintained and that folks have the what they need to be able to continue this. And I think, just to echo what Christopher was saying around the things that we're thinking about with youth and how long this is going to go, just to kind of reiterate that we want to think about that with our staff too, and a lot of the things that we're suggesting around managing anxiety and managing the how to deal with just what everybody's going through right now, it is directed towards our youth, but it's also applicable and important for our staff as well. And I know I saw some comments in the in the chat box around that too, and Joanne and others, and folks mentioning Sherry around just being open to the idea that a lot of the sensory stuff, a lot of the when staff come into to work, into their shift, around calming techniques, those aren't just for traumatized youth. Those are human interventions that are really helpful when folks are going through this, and it's a way of galvanizing and bringing youth and their adult caregivers together in a really powerful way. So just wanted to put that out there as well.
Well, I think you bring up an excellent point, and just recognizing that this is a traumatizing kind of environment for all of us right now, and we need to take care of everyone. I did want to just talk to Carrie, if you could share with us a little bit of some of the lessons learned at the ACRC conference that happened this week.
Yeah, thanks. I appreciate it. Hello, everybody. So we also, like the league, we're going to have our annual conference in early April, and made the decision, like everyone else, that we had to cancel that event, and did this enormous virtual pivot where we took the bulk of our presenters and switched them to a virtual platform, a really integrated platform where people can chat together and move from presentation to presentation. And there were a few skeptics, and we definitely showed them that this can be done, and this might in some ways be the next step of at least the near future of how people will interact with each other. And we ended up having almost 600 attendees on that platform. So we had a lot of our original best practice clinical excellence presentations prepared, as well as addressing COVID-19 with residential providers. And a lot of the things that we heard woven throughout our conference are the things that I'm hearing here today. It's a lot about innovation. It's a lot about partnerships, not a lot of competition going on amongst programs. Certainly, it's totally the opposite. For example, a program that perhaps has a good supply chain established and opening the door for smaller organizations in that community to participate in ordering through them to make sure that nobody was cut off for food and for supplies. And something that really stuck out throughout that conference as well was about relationships. And we talked a lot about staff and about families, but really relationships with each other, relationships with your licensing bodies, your regulators, your payers. So the programs that had those really good, well-established relationships prior to COVID-19 are really reaping the fruits of that right now. So they're allowing for innovation, which I think is the biggest word that we should be using right now. Yeah. Is we can't do things the way we were doing them. It's the time for innovation, certainly still playing within the rules, but reaching out to those people that regulate you and license your programs and talk about how can we be innovative and make sure that we're engaging families and we're meeting the needs of kids and families. We're continuing to accept kids who need to be taken into programs. Maybe our discharge planning looks differently, but those are really the key points throughout that conference. A quick thing about PPE. So right away, one of our keynote presenters talked about this. As soon as he knew that something big was coming and we would need PPE for his staff, he bought every raincoat, every slicker, every rain poncho he could find as an alternative to having gowns. And he bought every bandana that he could find. And so I know a lot of programs are using bandanas in the meantime since they don't have the right PPE, but they're finding innovative ways to meet the needs of kids and families. And we have members actually across the world, and we have asked them to chime in on what's going on in their parts of the world. Some, like in Spain and Germany, who are ahead of us in this issue, and listen to what they're doing in their own countries. And we have it all captured if anybody wants to listen to it. Interestingly, one program in Germany said, we asked them, what are you doing with young people who aren't in school and getting a little stir crazy like the rest of us? And she said, they actually know that this is kind of a big deal. And even the kids are stepping up right now and understanding that they can be part of the solution too. So don't take away that youth voice, that family voice. It's all really important to how we're serving kids and families.
So that all sounds really wonderful. And I was wondering if you could talk about what some of the innovations are around connecting specifically to families. So were there discussions around how to connect to families in this environment?
Yeah, there were broad conversations about it, but we would in this instance, like we do every other time, is ask families themselves, how would you like us to be as innovative as possible with you? What does your family need? And just like Mark said something about actually writing a letter, somebody said, we're rediscovering the art of actually talking on a telephone, making whatever resources are available that meet that family's needs, because all families are at different levels of ability to communicate with their kids, again, even before COVID-19. So I would reach out and ask your families and the young people in your programs for their voice and how to be innovative here. It really is them we're talking about, so giving voice to that would be really important.
That's wonderful. Thank you. There was a comment that has come up that I just wanted to make sure that we gave the whole panel an opportunity to talk about, and that is with the issue of masks and folks wearing masks. the fear that our young people might experience with a staff member wearing a mask. I was wondering if anyone wanted to sort of address that particular comment that came up.
For me, the most important thing is what's the messaging we're giving to the young people about why we're wearing masks. And I also think there's opportunities to get creative about the kinds of masks we use. I have a friend who's a crafter, and my mask is very stylish. But you know, we can put mouths on our masks, we can put smiley faces on our masks, we can have the kids help to actually make the masks and design the masks and draw on the masks. So I think it's an opportunity for the kind of creative genius that it happens in residentials all the time, and tap into that. I see Lori Keogh from NFI did a mask making group. That's great. I think, again, this is an opportunity to have real conversations. You know, I don't think that caring for young people means that we don't tell them the truth about what's going on in the world. And in fact, it's even more important that we use these opportunities for children who, in many circumstances in their life, truths have not been told to them, or things, control has been taken away from them. And so how do we give them control over the things that they can still have control over in this unprecedented time? I mean, that's kind of a 101 of anxiety management. So I think we want to be honest about why we're wearing masks and asking our staff to wear masks, that it's part of good care for you right now. There's this thing called a virus out there, and it's so small you can't see it, and it can slip around, and if you sneeze, you spread it, and so that's why we have to cough like this, and we have to make sure that we're washing our hands extra long and extra special, you know, 2 happy birthday songs in 20 seconds. And that's part of good caretaking, particularly during a pandemic. So I don't think the issue of the mask, whether or not, I think it's really what's the communication. If you do make a decision to have your staff wear masks or have the children wear masks, why are we doing it, and what's the reason? And I think it's part of good caretaking.
Christopher, while we're talking about this, I think that there are some challenges with young African American men wearing masks that we might want to just put out there as a kind of talking about some strategies for all folks to talk about around this issue of masks and what it means, and how do we address it? How do we address the fear around that particular challenge in our communities? I mean, I get it in the residentials, you know, and I think staff get to control and manage that, but how do we prep our young people for when they're leaving those residential programs and returning to the community and returning home wearing those same masks that we just talked about them making?
Yeah, you know, and I'm happy to turn that question over to any of the other presenters and panelists who have something to weigh in on that. I mean, one of the things that we're finding in this pandemic is that racism and racial disparities in healthcare and inequality are showing up differentially in those being most impacted. In Massachusetts and in the city of Boston, we're finding that the death rates for the African American community who are becoming infected with COVID-19 are twice what their representation is in the population. So 40% of people who have died in Massachusetts are African American or Latino, and they only represent about 20% of the population. So that probably has to do with underlying health conditions. It probably also has to do with living in close proximity to others. It probably has to do with access to health care. All of the things that we know are drivers of inappropriate or inadequate healthcare access. So once again, the usual victims are being overrepresented in this pandemic. There also happen to be the most common hourly workers and folks that don't get to have choices about working remotely, like so many of us who are on the panel.
I think that we just want this group of folks to really think about that and really be prepared and prepare our young people for the realities of this pandemic and the necessity for the masks, but also the ability to have some strategies on how to deal with that when they return to the community. I know it's Friday afternoon and folks have a lot happening, so I just want to see if we can take 1 minute and hear from each of the panelists who wanted to share some comments as we get ready to sign off for the weekend.
Do you want to toss it to us one at a time so we don't all talk over each other?
You're up.
All right. I want to end on a positive note. I'm seeing amazing creative responses to this pandemic from people making masks for the frontline workers, people doing these teddy bear hunts in their community where people are putting teddy bears in windows and people are driving around looking for them, to staff being creative about the ways that they're expressing what's going on in this pandemic to the children that they're working with. So I think it's critically important for us to stay positive, because the way children are going to interpret what's going on is by looking to the adults in their lives and seeing what kind of response they're having. And if we convey our own internal level of distress or anxiety or feeling overwhelmed, which I would imagine all of us have felt in the last couple of days or weeks, children are going to get more panicked than they may need to be or should. And so I think it's really important for us to convey hope and optimism to ourselves, to our children that we're working with, to the families that we're fortunate enough to be in contact with, and to our coworkers.
Thank you, Christopher. Carrie, I was wondering if you had some comments for this group. You're on mute.
No, I'm not. Thank you. I think that what's really key here, thank you for that, Christopher. What's really key here is communication. So what we heard over and over again from our members at our conference was how they've ramped up communication to everybody, how they're having weekly calls with their staff, all of their staff, their direct care staff. And I think what was really profound for me was one person said that they had a direct care staff person say to them, I feel more like I'm part of a solution, more like I'm part of a team in the middle of this crisis than I have in the last 5 years that I've worked here. So keep up the good work, keep up the communication with everybody, with your partners, with people who maybe were your competitors before. We have to have that sense of we are all in this together. Residential providers throughout their history have been scrappy. And this is a time to use that innovation and use those skills and just push it all forward right now until we can fall out of this.
Thank you, Carrie.
Yeah.
John?
That obviously to continue to talk to each other, to learn from each other, and obviously improve that communication, but also to talk to what I guess I'll say is, I don't know, the public or opinion makers, whether that's your federal government, state government, the media, your community, to because I think, as we just discussed, I think this crisis, this pandemic, is highlighting the disparity that exists in this society, not just the racial issues that have emerged, but also, as you've heard, and we've heard, the low-income workers who are working at facilities and providing this work, as well as the families. And I think this country has changed. We don't know what the society will look like on the other side of this, but I'm sure we will be changed in many ways. Some ways good in terms of practice and what we've learned, but also hopefully we can learn from this and change some of those disparities as we go forward after we've gotten by this. But it'll be based on people, the public across the board, and policymakers understanding the complexities and the challenges that everybody's dealing with.
Thank you, John. Mark?
Well, there's a lot to say, I think, but in a minute, I'll just say that, you know, I know this audience is a group of folks who are in the business of healing and holding hope. And I think that this is an important test for us in terms of those, you know, those skills. You know, I'm struck with what Christopher said, and to piggyback on Carrie and sort of bridge those two realities, in particular around our, you know, our client base has been enduring the impact of trauma and chronic stress and toxic stress intergenerationally for long before this. And it does create certain vulnerabilities, and I really appreciated the way the conversation had shifted into that, but it also highlights those communities' resilience and their strengths. And I think we have a lot to learn from them. And what Carrie was talking about in terms of how to incorporate and bring in families' perspectives, the best way to do that is to ask, because they've been enduring a lot of these types of risks long before this, and will after this passes. But just the idea of what we can bring to bear in terms of being a resource for youth and their families, and then the broader community, is tremendous. And I don't want folks to lose sight of that in the context of what is a highly stressed and very complex environment. But it's something where, you know, I get to show up for work every day and get inspired by all of you who are on this call, in terms of the way you show up for youth and their families, and have done so for, you know, generations, and will continue to do so through this and beyond it. So I'm really grateful for people's ideas, and I think Carrie's exactly right. Communication is key. You know, somebody was telling a joke a couple of weeks ago about just the fact that everybody seems to be reading all their emails these days. And just really grateful for UMB and y'all's leadership around putting information out there and giving people access to that. I think it's a critical component of managing our own anxieties, and we'll continue to do that as we can. Thanks so much, Liz.
Thank you, Mark. So I'm just going to end my part really quickly by saying the biggest lesson I learned in working in the residential world is that crisis equals opportunity. And I think this crisis equals big opportunity for us to learn and to grow and to work together. And for folks who are interested in thought partners, I think we are interested in trying to figure out how to take those innovations and make them real, to count them, and to make them long-term, work in the long term. So thank you all for being here today. Denise, I'm going to throw that back to you. And I just want to thank all the panelists. Thank you very much.
Thank you, Liz. On behalf of the Institute and the TA Network, I really want to join all of you, particularly on a Friday afternoon. We appreciate the commitment shown by all 476 of you who joined us today. With all of the unknown that lies ahead, including how long we will be working in this new COVID reality, it's particularly important in residential services where residents feel especially isolated to continue to work together, do this in partnership with families and youth, and commit to continuing our work together and looking for forward-looking solutions. As we keep, as someone put in the chat box just now, the needs of the families and the youth we serve at the forefront. Thank you for all the work you do, and please be sure to take time to take care of yourselves and your families while you're taking care of others. Have a great weekend, and thanks again.